Hello? Hopefully I'm live. Um, Hello everyone, Nintendo Ness here once again. Today I'm actually going to be doing something a little bit different. In fact, this is actually the first time I use the Streamlabs just for the webcam. Um, it's actually kind of quite useful now that I think about it. Um, just a quick side note, because I'm able to see the chat on one side and then some notifications, everything does pop up on one side, so actually kind of, this app is pretty useful. Um, anyway. Hopefully you all had a good week. Um, I mean a good weekend. I actually had a good weekend. Um, but and hopefully your all's week is starting off really well. So today I kind of want to do something a little bit different. Something I've never done, I guess, yet. But well, but before I start, if you're not interested in this, don't worry. I completely understand. This Thursday I will actually be doing something gaming related. So if you want to check out that, do check it out on this Thursday, probably in the morning. But hopefully y'all will join that one. It's gonna be a little fun, that one. Um, but anyway, so today I actually want to do something a little bit different, and I guess it's a bit of coincidence. Um, Today is actually what people call Suicide Prevention Day. Here in the US, I know it's Suicide Prevention Week, but today is actually the day where the whole world celebrates it. So I think that's pretty good. But anyway, I guess and it's been a coincidence because today I actually want to start a new series. Because for those of you who do not know, I am a college student, and while this semester I'm not focusing on nursing, I am actually focusing on psychology. Um, And while yes, I am taking multiple psychology courses, there's actually one that really does stand out to me that actually feel that it'll be a good discussion starter with, and hopefully I want to share that with you all. So the class I'm actually currently taking is, well, obviously, abnormal psychology. Hopefully, y'all can see that book. Um, so yeah, so I'm doing abnormal psychology this semester for one class, and it's one of the classes that I feel it's a very interesting yet important topic to learn about. And the reason is because uh, there's so many like topics I can think of, and I know, and the reason why I'm choosing this, I like my other psychology classes, is kind of for three reasons. My first reason is because it's something that I have passion for. I like learning about the different kinds of mental health conditions and disorders. Um, I do have a passion to kind of, talk about it and probably raise awareness on it. The second reason is because I um, hope to kind of at least provide some general knowledge regarding like each topic that I talk about. Um, And honestly, I hope to at least have a good discussion starter with you all, kind of to talk about certain types of mental health conditions and disorders and things like that. So hopefully, one day I will, you know, uh, hopefully one day people will learn something with this, just general knowledge. But yeah, so hopefully I actually do plan on starting that. And starting, so since today is the first day, it's just going to be like a quick introduction to it. Which also another thing before actually I do officially start, please do not take any of what I'm talking about as absolute medical advice. I am currently a student, so I am not in the profession of seeking out medical information, or if or any like serious medical knowledge. I'm only here to discuss general knowledge in certain topics of abnormal psychology. If you do have a something you'd like to discuss, please do. I do strongly advise you speak with your healthcare provider and any other people you trust within your medical care. These are just my opinions regarding abnormal psychology, my general thoughts, and also just a good one-on-one discussion with you all. But anyway, so with that out of the way, time to start on actually talking about abnormal psychology. So, what is abnormal psychology? Abnormal psychology is actually one of my favorite topics in the nursing. I mean the psychology field. There is different types of uh, other types of psychology topics to cover in. For example, there's behavioral psychology, which that just basically deals with learning how to change someone's behavior. There's lifespan psychology, which that is towards the learning how we think and act as we grow from birth to old age. And there's also social psychology, which is basically how we think uh, within different social groups. And those are just a few examples. But my main, uh, but my main topic is is talking about abnormal psychology, and abnormal psychology is more, I guess you could say, towards the medical field. The reason why I say that is because it does actually deal with like mental health conditions. You learn how to kind of like diagnose, treat, uh, you know, all that kind of good medical stuff. Um, and honestly, it really is something that I guess it kind of pertains towards even the nursing field when I think about it. Because there's actually when I go into the nursing program, there's actually a mental health nursing class I will be taking, which I guess it kind of basically follows on top of what I'm learning right now. But yeah, so abnormal psychology again is learning about the different kinds of mental health disorders, how to treat them, and possibly even how to prevent them. Um, and generally, abnormal psychology is kind of relatively, I guess you could say, new, um, but it's not always uh, what is it? It's not always seeking for that. But so abnormal psychology is towards medical field, and regarding that, it definitely is something that I'm definitely interested in. Um, so I guess, and again, I guess it kind of coincidentally today is Suicide Prevention Month, or I mean a week, and I guess this will be a good time to actually start on this type of topics. So basically, starting not next week, but the following week, I'll be starting like the actual topics themselves, um, like different the conditions. For example, I think one of the very first ones we're going to talk about is the most popular of them all: anxiety, uh, obsessive compulsive disorders, um, things like that. So that's something going to be a good start to uh, good topic to start off on. Um, but that will be after I take my first exam, which is next week. So next week there may not be an actual live stream dedicated to that until after the exam. But definitely after that, it will be like a once a week type of thing where I'll discuss like each chapter I learn and share with you all. Um, so today I kind of just want to do the introduction. The reason I guess also I didn't really start the first week when I start the class is because the first like obviously like the 2 or 3 chapters, it's kind of like an introduction, and obviously I didn't want to bore anyone with all the history and things like that. So today I just wanted to do an overview, an introduction, and kind of just discuss abnormal psychology in general. So yeah, so I kind of explained what abnormal psychology is. Obviously, so yeah, so basically within abnormal psychology, you kind of need to know how to basically uh, define patients who are thinking abnormally, and a good way to kind of uh, look that out is looking how they react. For an example, if they um, not only how they react, but I guess also like even like testing them, for instance. Because as an abnormal psychologist, you need to know how to determine what's abnormal and normal. And one thing that I guess that kind of makes it more difficult, well, not difficult, but interesting is like how we as a community how we as a community act on our daily lives. And there's this general like norm on how we're supposed to, I guess, act in our everyday lives. But I mean, obviously there'll be some people who are more unique, who are, different, and there are some who actually, will think differently towards it all. For an example, and this is actually coming out of the book, from an example that I remember. Let's say you're walking down the street or the city, and you see everyone wearing basically like average clothes, work clothes, day-to-day clothes, things like that. But then you see, let's say a couple is dressed up as Superman and Superwoman. Well, obviously, if you see them down the street like that, you probably think that's not right, that something must be wrong. But actually, coincidentally, uh, not everyone knows the whole picture behind that reason why they are dressed up like that. So we may think that it may be abnormal to us. However, for them, what if they're going to like a convention, like for example, Comic Con? Or what if they are dressed up for a birthday party, you know? Um, and I mean, yeah, I mean that's one example that makes it interesting. Yet, it's not that we don't know. We obviously do not know everything what's going on in each person's lives. So, I mean, I guess in general, we as a society tend to think quickly as to how a person thinks, reacts, and things like that. But, from an abnormal psychology perspective, we need to know, we don't know the full story or the full setting or background as to why people think or react like that. Um, and that is one reason why um, I mean, that's one reason why psychologists need to know a little bit more information. That's where I guess the assessment comes into play. Now, now, in order to assess people, there is certain type of different things on how to test them. For example, one is basically asking people about their life in general, kind of like a survey. Well, not survey, but just like an interview. Um, and with that, obviously, we will want to know more about their life, more about, what is causing them to think like that way. Um, you know, thinking about it's causing them to think differently. And who knows? Obviously, if, for example, if the psychologist finds that everything is fine, well, then there's no reason for a diagnosis or treatment to be administered. You know, so that's why it's important to get that kind of interview to at least know the the patient, and that way they'll know what's going on in their lives. Another way to assess people is actually, I guess, another popular method that even you all can do it yourself. It's called assessments. And there's different kinds of assessments that are even online available, like right now. You can actually look it up. Um, and there's different assessments, for example, like your personality. What type of personality do you have? What is your what type of personality do you have, and how do you interact with others? There's certain tests like that. Some of it's pencil and paper, but there's actually online exams as well that you can actually do it yourself if you're curious about it. Um, but um, the other kinds of tests are like personality, relationship tests. Um, what's another one? Social exams like how well do you interact with your friends? I guess how social are you? Um, Another thing is like an IQ test, although an IQ test it's a little more harder to kind of uh, even get on your own. That would probably have to be from a form like an actual psychologist. But those are IQ tests. That kind of IQ test is a test where it kind of determines your knowledge in general and how smart you are. In other words, I guess you know in a general perspective. Funny or not, I actually did take an IQ test myself. Um, I believe I was in 10th or no, actually, no, I take that back. I believe I was actually going to be a senior in high school. Um, and well, I took the test and supposedly I wasn't I wasn't even in the average norm of a person's thinking level, critical thinking level. Supposedly, I was fit to be in an office environment where just like sitting down, writing paperwork, and all that kind of boring stuff. And well, I mean, obviously that did kind of bum me out a little bit because I wasn't looking forward to actually see, what an IQ test is and how it can actually determine what you are. But then I kind of realized that personally, IQ tests they really don't determine who you are. Um, I mean, look at me right now. I'm currently in college for nursing, and I graduated with a medical assistant certificate after all. So I mean, do I look like I'm fit for an office? No. So no, I mean that's something that happened, but um, again, when I found out about that, when I got my results, I was like, no, you know what, just no, I'm not gonna take it like that. I'm not gonna take it as that kind of perspective um, on abnormal psychology. I mean, on my IQ. So I disregarded it. I knew I moved on with it, but I mean, it's those kind of tests that I guess do have some kind of um, what is it, correlation with how you really are, but then at the same time, it really is up to you on how much how much you act and things like that. So that's kind of test I'm not really not much on a fan of, basically. But yeah, so that anyway, that is another type of assessment that people can know. Now, there's even like actual physical tests that psychologists can administer, like actual MRI scans, CT scans, and any type of like neurological exam. And the purpose for those is to see any kind of abnormality within the brain itself, because there are some type of uh, mental health conditions that actually do deteriorate the brain cells itself. For example, I think one is Alzheimer's or dementia, um, and that I haven't gone over that topic yet, but I do imagine it. I do know it's something to do in relationship with the brain activity itself, and it kind of destroys the neurons within the brain. But just kind of an example on those kind of um, actual physical tests that you can be done. So so after you get like all those kind of tests, how do you actually become diagnosed? Well, there's actually something called the DSM, and actually I do not know that. I do not know the actual name, but let me look quick in the book because I actually don't remember what the actual name for it is called. Um, but let me look here real quick. It's called DSM. I know that. However, it definitely is something. Let me see. Women's chapter. Yeah, again, this is kind of why I kind of like skipped like going into each in general because it is kind of like a little bit of a too too specific, and I kind of didn't want to go over the you know the specific and kind of like bore anyone. But real quick, the DSM is called the oh yes, it is called the Diagnostic and Statistical Manual of Mental Disorders. I know it's kind of a mouthful. But in generally, basically, the DSM is basically a kind of like a category, like an actual rule book of how to identify a mental health disorder. And currently, there are over, if I'm not mistaken, 500 mental health disorders in within that book or manual. And psychologists go through that book to kind of determine, okay, what does this patient, you know, stand for? For example, let's say a patient is, always crying every day. They don't feel like getting out of bed. They don't eat that well. They just, are kind of like they have low self-esteem. They just don't want to do anything with their life. Um, so obviously, they would use that book to determine, what kind of psychological disorder they have. And obviously, for example, just as an example, that would be considered a uh, depression. Um, again, haven't gone over, those specific chapters yet, but, this is off the top of my head. So um, since I do know like the basics of some abnormal disorders, it would be somewhere along the lines of depression, the depression disorder. Um, but yeah, but basically psychologists use the DSM to look for the type of mental health disorder that a patient has, and they use it frequently. Now that thing does get updated, every so often, but the last one is the fifth edition, and actually people are kind of skeptical about even the DSM itself because they feel like some symptoms fit with other categories and things like that. So some psychologists do kind of use it, but then some of them just use on their own judgment, um, based on what they have tested or learned about the patient and things like that. So basically, so yeah, so I mean, is it really like an effective way to diagnose patients? Mm, yes and no. It just depends on the psychologists themselves and kind of like what they believe the patient really does have. But again, it's just more of like a general guidelines as to what people, uh, as to what the general functions in people are. Um, so, uh, so basically, when you actually diagnose people, how do they get treatment? Now, this one, it's actually a little bit more easier for me to explain as the others, but there's different kinds of treatment, and obviously the most common one is therapy. Uh, Now, therapy happens to be, there's different kinds of therapies when you think about it. There's family therapy, there's cognitive therapy, and there's, couple therapy, like couple counseling, in other words. Um, and I mean, yeah, there's so different kinds of therapies, and within those therapies, they kind of spread it over like a month, couple months, or like even up to year-long sessions. And generally, like psychologists work on like little goals to kind of help people or help the patient improve on what they came in on in the first place. And actually, therapy is actually pretty beneficial. In fact, people think it's more beneficial than even like taking medication itself, because it just seems to be that effective. Now, it's not 100% effective since there is like a small percentage of people who develop who actually even get worse as they do therapy. However, it just depends. I mean, again, it just depends on the individual, how the progress is made, and how each session goes. But that, therapy is like the number one most used and frequent treatment that people benefit on, and it's pretty interesting to know about that. Now another type of, and yes, I'm actually kind of going by the book, just kind of refresh my memory on like in general. Another kind of treatment is psychological medications. Now the thing about those is that usually they aren't prescribed on their own. They usually are in combination of therapy, because it really is beneficial to do both if necessary. However, normally there is you don't take medication and that's it, no, because that will not be beneficial as much. But there is kind of like a controversy regarding psychological medications, and that is because there's kind of like some type of side effects in basically any kind of medication, especially like I guess you can say antidepressants. And actually now that think about it, there's different kinds of psychological medications. There's antidepressants, which help obviously relieve people of depression. There's anti-anxiety, which help people with anxiety. There's medications for like people with ADHD. There's medications for like OCD, things like that. But yeah, in general, it is a little bit controversial to kind of give medications, only unless they people really need it, or I guess request it, because of the side effects that they can have. I'm pretty sure some of y'all have actually like seen on TV shows or things like that, um, where there was like an antidepressant drug, and it says like in real fast, there may be, start this medication and talk with your doctor if you have thoughts of suicide, or if things do get worse, um, in regards of the depression and, anxiety and all that. So I mean, it is kind of like a reason why it is controversial. Um, the good news though is that for the most part, uh, depending on what the psychology, well, actually no, psychiatrist is the one who actually prescribes medication, but for people who are prescribed psychological medications, it generally works with therapy. It's pretty effective, and it generally does, over the course of like a couple of months to a couple of years, it does really effective, and it works very well. But so basically, yeah, that's in general, in terms of the treatment process. Um, and this is something that hopefully I'm gonna get more into detail as time goes by. Um, Again, since this is more of an introduction, I'm not going to go into any bit specifics, talk about any specific conditions. This is kind of just like the beginning of me introducing the abnormal psychology series in my channel. Um, so definitely the week after next week, do expect uh, at least one live stream once a week, dedicated to talking about it, uh, talking about each condition or basically each chapter as I go along. And like I mentioned, actually just to double check, I think the first one we will go over is, let's see, just to kind of like give you all an idea real quick as to what will be the first one. Yeah, yeah. Basically, the next section is anxiety and mood, and the first chapter will be anxiety, OCD, and uh, related disorders concerning about that. So yeah, I'm definitely looking forward to that one because that is actually one that, I guess one of the most popular ones that I'm interested in learning about, and how people get treated with anxiety and things like that. Um, but yeah, hopefully, I know this may not be the type of series for everyone, but hopefully y'all enjoyed it. Y'all will enjoy it, and look forward to these type of streams. I do hope I can make at least some small of a difference in the end when the semester is over. And I guess it does kind of fit with even my channel in general because I do kind of want to do have gaming, have like my experience, and I guess learning about animal psychology is part of my experience. So definitely I will be sharing more about that. However, that is something that I look forward to. But yeah, so again, since today is Suicide Prevention Day all around the world, I guess just to give a general message to you all. Um, it's good to raise awareness on topics like this because there are so many people out there that have a mental health disorder that no one doesn't even know about. Some of them just are good at hiding it themselves, and you know, it's important to be there for one another. Um, that's why it's always good to even like give like small gestures every day, like like smile at someone or have a quick chit chat with them, because it does make. And it's like what they say, small differences do make a big. I mean, small things do make a big difference. Um, Even for those people who are having tough days and things like that. But again, since it is Suicide Prevention Day, I felt today was actually one of the best days to kind of introduce the video series. And actually, hopefully by the not next week, but the other following week, um, we will get into more of the deeper topics, and I look forward to actually, sharing them with you all. But yeah, so that is it basically for the end of today's live stream. Um, Again, for those of you who are not probably weren't interested in this kind of topic, don't worry. I did mention it was going to be half and half, like equal type of thing. So on Thursday, I do plan on making a video or live stream actually about my gaming collection so far. So, which basically I want to show you all the games that I have and talk briefly about each one. And I do look forward to that. So it's going to be real fun that day. Um, I probably will do it in the morning because, yeah, I think at nights it may be a little bit more tough to do. Kind of like in the mornings and early afternoons, I'm a little bit more free during the day for the most part. So definitely do check out for check out check out for my post on that in my social media, which actually you can look subscribe follow them in the description below of this video. And yeah, so and also on Thursday I do plan on getting something that will definitely probably take me to the next level in terms of gaming. Will it work? I do not know, but I'll be excited to test it out, and if it does, it'll definitely be a game changer for the channel. But anyway, yeah, so that's about it for today's live stream, everyone. Hopefully you all had a good time. Again, just kind of wanted to give a general overview of psychology today and introduce it of the abnormalities and things like that. So I do look forward to sharing the next one with y'all, not next week, but the following week. So until next time, uh, thank you.